Um, we have Daryl. I'm guessing Sally just said her point, and Isidro.
Yeah, I just wanted to mention that at our last Health and Environment Committee meeting, we had a very robust meeting about fireworks and the noise that creates, as well as subsequently people just hang out while they're shooting the fireworks and after and create the noise. And I just want to point out two things. One is to thank Tanya for spearheading that conversation. That was a really great conversation and one of the best community engagement committee meetings I've been to. And also just to point out that many of the elected officials, most of the elected officials, either just don't care or weren't there for that and have not expressed the will to do anything about that. Point that out.
Okay, thanks, Daryl. We're going to move on since a lot of, do you have a point of information? Because
No. I need to speak because you allowed all the board members to speak, and I cannot be overshadowed because now you have to go to the public session.
no, we're not.
Let's be fair.
Session. We're not publishing the public session. Eliasar said that the points that are related to noise, we're gonna take those Q&As and comments after the noise pollution presentation, because it's all related to noise.
Right, and my comment is related to noise.
Okay.
So
right. I just want to say that the noise has been a problem. I've been attending and going to different places in the Heights and Inwood, and there are many people that come from outside the community to make noise in front of restaurants. Oftentimes, they raise the music, the volume really loud, just to bother people that are having either dinner or if not, just eating outside, and you can even hear yourself at all. So it's a big problem for the community, but I just hope that we do not blame the local restaurants. Most of them are complying. They're in compliance, and a lot of people come from the outside to make this noise, and it's really, really annoying. And I agree with most of the comments that have been said. Thank you so much, Catherine.
Okay, Catherine.
Okay, so in respecting also our speakers' time, I know, Liz, you're waving. Is this a point of information, or does it have to do with noise?
It's a procedural thing. So I have a short video which should be played during the public session since it relates to noise, correct?
Yeah, we just, okay. We'd like to, thank you, Liz. Let's just have the presentation just to be fair to our presenter.
Yeah.
And they're patiently waiting for her turn.
Great. Okay. So as folks who have seen the agenda tonight, we have a presentation from Dr. Wendy Chung from Columbia University Medical Center related to the COVID Recovery Corps. And they'll be talking about a new research initiative related to COVID. And so we're really excited to have you present and update us on what's happening in the hospital.
Good. Thank you so much for having me. I want to check and see if you can see my screen. Is that sharing?
Yes.
Okay, very good. So I am a professor at Columbia University, and I think everyone appreciates just how much our community's been impacted by COVID-19. This was a recent publication that came out of the patients at Columbia University, and I'll be using this to explain what the next thing is we're looking at, which is how individuals are recovering, hopefully getting better after they've been affected. However, as we've seen this, our community that we served at Columbia is representative of our Northern Manhattan community. As we looked at individuals to understand who was sick in the hospital and who died of COVID-19, these are things that I think you probably appreciate, but we have individuals who are more at risk. Individuals who are older, we're at 6 times higher risk of having severe outcomes. Individuals with heart disease, diabetes, lung disease, as well as smokers. We don't understand all of the factors that are related to this, but we do understand these are individuals that are at higher risk. Relevant to our community in Northern Manhattan, this is not an equal opportunity condition. This virus affects certain members of the community more so than others in ways that we don't entirely understand. There's a higher burden in terms of both hospitalization and disease severity and ultimately fatality or death in our Black community as well as our Latina community. And that's something that concerns all of us very greatly. As we've been getting over the other side, I hope, after March and April and what was truly very trying, we are continuing to follow individuals who've been sick at Columbia as well as other places around the city and around the country. And we realize it's not resolving for everyone as quickly as we would like. So as I've been seeing patients, I've seen patients that continue to have issues in terms of shortness of breath, continue to be very tired, very fatigued. And I've also been hearing many complaints about everything from fuzzy thinking or difficulty concentrating to difficulty sleeping and just not feeling like themselves. And as we're doing this, we're trying to learn from each other. What are things that seem to be helping recovery? What seems to be hindering recovery? And trying to learn from each other so that we can all do this faster and be able to get better faster. I've been working with a group that's called themselves Survivor Corps. And they've called themselves long haulers, those individuals who have symptoms that don't seem to be resolving. And it's been incredible to be able to hear from them one-on-one, their stories, their issues, and they've been helping us to design a study to look at individuals who have previously been infected and understand, as I said, differences, both how long it takes for people to recover, and then the symptoms that seem to recover faster and those that aren't recovering so quickly. And long term, we hope that we can use this, as I said, to either think about medications or strategies that might help people get better faster. So we started a large study that's called the COVID Recovery Core to be able to get at these issues. As I said, to understand the issues around recovery and understand, if we can, what some of the contributors might be. And some of them might be pre-existing health conditions. So people who had diabetes, heart disease, lung disease before, maybe their body wasn't quite as strong and the virus did, push them over the edge and cause some permanent damage. But in addition to that, it may be issues in terms of access to care, being able to get to doctors, being able to get to medicines, continuing to need to work, not having access to healthy food, all sorts of stressors that we might have. And understanding these contributors is important to us. One of the challenges that we had back in March and April is that we didn't know many people who were actually sick with COVID-19. If you can remember back in, it seems like years ago, but really just a couple months ago, we had so little testing available that we've had many people who thought they were sick, but we don't really know for sure if it was COVID-19 or not. So we're launching this study as twofold. The main goal is, as I said, to understand how people are recovering and whether or not this is any different. I will say, I think we as New Yorkers are proud that, unfortunately, since we're seeing some of this come up in other parts of the country, we may be able to lead the country. We may be able to come up with understanding because we were first, that we may be able to help family members, friends, others around the country. Part of this, though, is to understand back in March and April who really had COVID-19. And so, as I'll be explaining, one thing we're doing is we've developed an antibody test, which allows us to look back because of the body having mounted an immune response and fighting the virus to be able to see evidence of previous infection. And we're guessing that in the community of Northern Manhattan, it may be something like 20 to 25% of individuals who have been previously infected. To do that, we need to check in the blood for antibodies and see who was tested. And then once we know who was tested, that allows us to then go forward to know who's getting better and to be able to make sure that we know that it was COVID-19 related. Realizing that this is something that we wanted to offer free to the community, so free testing for everything, and wanting to be able to make it as convenient as possible, we've wanted to allow people to do testing from home. And so what I mean by that is you don't have to miss work. You don't have to even come to the hospital or the doctor's office. We wanted this to be something that people free from home, convenient, easy, and getting their individual results back, hopefully within a matter of a day or two once we receive their samples. And again, we would pay for the shipping, we would pay for the testing, we would pay for all of this, and share information back with each individual participant, as well as what we're learning as a community, sharing that back through forums like this, but also through newsletters and other email alerts and updates. To do this, we're thinking about doing it on a scale, and we have the support already to do this for 11,000 members of our community. If this is something that looks like it's useful, we have permission to be able to go on from there as well, but we're starting with this group. To do this, though, one thing we have to do is to develop a test that we can do testing from home. So phase one in this, which is a critically important test, is to take what we think will be about 1,000 people where we can take samples, blood samples, but also a sample that would be easy to collect from home, something like a saliva sample or something where you would prick your finger and put a spot of blood on a blood filter card, but something, again, you could do from home without having to go get blood drawn. So in phase one, we're going to be having individuals where we compare what happens when we measure from a blood drawn in the regular way, from a finger stick, or from a saliva sample. Do we get the same results in all three ways? And once we know that we do, whether that takes 100 or 200 or 1,000, I don't know, but once we know that test with home testing works, then we can get kits out to on the community, and like I said, be able to do this on a much, much larger scale. So to do this, I'm here tonight, and thank you for the opportunity to tell you about this website, COVID Recovery Core, which is up on the upper left here. This is the website that's live, and you can log in here and join us to be able to join the study. Again, everything about this is free. And for the first individuals who need to get the blood drawn for the phase one, we also have a $50 gift card. So in terms of being able to do this, appreciating that it takes people's time and energy to participate, we want to be respectful of that. And so we do have a show of our gratitude for that. As we're doing this, as I said, the eligibility criteria are pretty straightforward. It's adults, so it's individuals 18 or older who can sign it, who can be able to give permission for themselves, and that think they've had COVID-19. Because again, we're looking for people who were positive, who actually were infected in the past, and then we can check and see how they're recovering. As I said, because many people may have had even mild symptoms, we appreciate that everyone doesn't know they had COVID-19, and that's why the testing will be helpful, but you do not have to have testing to be part of the study. So as an example, if you had testing in the past, you had that nasal swab or you had another blood sample, and you know for sure you are already positive, you don't need to get tested again, and we're not going to make you do that, but you can simply sign up to answer some questions about how your symptoms are resolving and some ideas about what might have been helpful in terms of helping resolve those symptoms. So this can be done online from a computer, from your phone. We've made it mobile friendly. We've done really robust user testing to make sure it's really easy. The flow is simple, the questions are understandable, and this takes about 30 minutes to be able to participate. As we're doing this, as I said, all of this is through a New York State approved test. So you might have heard in the news about some fly-by-night testing companies where their results are not reliable. These are very reliable tests done at Columbia University with world's experts who have developed this test, as well as being able to get results back quickly to the community. So this won't be something you've heard about in the news where it takes a week or two to get results back. We will be getting these back very quickly as soon as we get the samples into the laboratory. All of this is made easy. So for those of people who do give a blood sample, we have a process you can be able to select your time and location online. So we make it really, I hope, quite convenient for you to do. And then as we do this, like I said, we're going to be able to use hopefully specimen types that are really easy, either, like I said, a blood spot or else one of these saliva samples. So as we do this, the whole point though is to learn along the way. And as we do this, we're going to be having videos that are on the website, community board meetings, newsletters that are going to go out. But as soon as we know, you'll know as well. So with this, these are just examples of the test report that's coming out. It's the same test report that I myself have gotten. So I've tried out the system to make sure it works, and the results are robust. They're the right results. And as I said, we're getting these results out quickly to people. So I'll wrap up here, but just to say and give credit to Survivor Corps, which has been one of the community groups that's been very instrumental in this. I'll extend an open offer. If there are any members of the community who think they might have useful feedback, we'd love to have your feedback and even potentially to help us on our advisory board. So I'll stop there and I'll be glad to take questions.
Thank you so much, Wendy. There are two questions in the Q&A that you can see. I can read them out for you.
Okay.
One is Lena Lendez asked if you could repeat the contributing factors to poor outcomes of COVID.
Sure. So the contributing factors are older age. I didn't mention it, but male, so men have a tougher time of this. Also heart disease, lung disease, and diabetes. Those are the main factors that we're seeing that are contributing. And then we're also seeing in terms of communities, the Latina community and the Black community specifically have had borne disproportionately a lot of the burden for this disease.
Great. And J.T. Royce also asked, in addition, if you're still accepting survivors, and how someone can get in touch.
Yep. So maybe we can put this in the minutes, but it's COVID, COVID, recovery, core, CORPS.org. That website, you can go right there. The upper right-hand button, join us, is how you get into the study.
Awesome.
Can you please send the PowerPoint to the community board office so that I can pull the notes off of that? Because there was a lot of information. I want to make sure the notes are accurate.
Sure, absolutely. And feel free to share these slides. There's
I
nothing.
was just getting ready to say that. Do we have anyone else who's raising their hand besides Angel Vasquez?
We have
Angel.
Aisha, Curtis, Stephen, Sally.
Just whoever hasn't said anything, put those first, and then those who have already spoken, then put those on the second tier.
So Steve.
I'm first?
Yes.
All right.
All right. Well, first of all, I think it's important that if we're having a discussion about COVID-19, that we recognize the fact that 914 people in our community have died as of today from this disease. We should not ignore the impact that this disease has already had on the community. I missed Dr. Chung. I missed the beginning of the presentation. Is it your intent that the 1,000 volunteers in phase 1 and the 10,000 in phase 2 would all come from Washington Heights and Inwood? Because the health department statistics show at the moment that we have had 5,146 positive cases in Washington Heights and Inwood. So I guess there's a presumption on your part that a lot of people have yet to be tested who in fact have had the COVID-19 symptoms.
Right. So we are doing the study within a 25-mile radius of Columbia. So that actually includes more than Washington Heights and Inwood.
Okay.
However, the community that obviously is right next to us at Columbia, I wanted to make sure had first dibs, so to speak, that they knew about it and were aware of the opportunity. Remembering also, though, that people don't have to take the blood test or the test in general to be part of this. If you know, there's lots of opportunities for testing. If you know you were positive from any of those mechanisms, we want to put that information together on as many as people as quickly as possible, because we obviously want people to recover. And as I said before, I think Columbia, unfortunately, having had the first wave first, is going to have a lot that we can teach the rest of the world about.
Okay, I should mention I'm the chair of the Health and Environment Committee, and I'm sure that my committee and personally, I would like to be able to work with you on this project.
That'd be great. I will also send with the PowerPoint my email, so if anyone needs to get in touch with me, you can.
I think Angela was next.
All right. Well, first of all, thank you, Dr. Chung, for that thorough presentation. That's really helpful. And I'm glad that Columbia is pursuing this. My question is, how are you all conducting your outreach in the non-speaking parts of the community. I'm assuming the website's also in another language other than English, but what partnerships are you utilizing or leveraging to ensure that you are getting that diversity of people that you're looking for, and understanding that the Black American and the Hispanic American community have been disproportionately impacted by COVID?
Yep, definitely. So the English version has launched now. The Spanish version is in the process of being approved by the IRB. So they are looking at the translation to make sure that everything is exactly as it should be. I'm hoping we'll be able to launch that within the next 2 weeks in Spanish, but everything has been translated and is with the IRB. We've had many community partners. Alianza Dominicana, Rafael La Antigua has been one of our partners in terms of thinking of, I would say, sort of the north of Colombia, and then south of Colombia, Harlem Hospital, as well as many of our faith-based organizations, our community healthcare worker core. We've tried to reach out to many individuals, but I'm sure we're not finished, and I'm sure this is going to still, COVID is going to be with us for a while. So if you have suggestions, individual contacts, organizations, we would love to be able to reach out even more than we have already.
Thank you.
There's Faye and Wayne. How about that?
Thank you. Can you hear me?
Yeah, we can hear you.
Okay, thank you. So good evening, everyone. Yes, my question is actually, and thank you, for this wonderful presentation. I think this is a very interesting update for us. I wanted to ask you, you mentioned that, and I have heard this before as well, that minority like African Americans, Spanish, these are the community that has been more affected. And this is something that I constantly, it's not the first time that I hear it only from you, but for other folks as well. And I'm wondering is at this point, you may have any idea what are the contributing factors for which this is the community that seems to be more affected?
Great question. So I think there are two factors. One was just in terms of getting infected in the first place. And then I think the second is once you're infected, how does your body do in terms of fighting the infection? In terms of getting infected in the first place, I think New York City as a whole, when you think about it, it was how many contacts you had before we knew to wear masks, before we had idea about how quickly it was transmitted. So people who had jobs, for instance, where they were out and about and in the public and interacting with many people, people who were taking public transportation, people who were living in buildings with many people or in households with many people tended to transmit and to get the virus very quickly. So I think that was the first part of things. The second part of things, though, was that who got infected, those individuals who already had issues like diabetes or who had heart disease, even people who didn't know they had those conditions, or even people who may not have been overtly diabetic, but may have had some pre-diabetes even, I think those people are the ones that we're seeing that are bearing disproportionately the burden in terms of getting either very sick or in some cases even dying. I think in terms of access to care and who had access to medical care, to know about their conditions, to get treatment for their conditions, I think that's where I'm seeing a lot of the unfortunate disparities in care, disparities that I don't think have to do with the color of your skin per se. In other words, I don't think it's a sort of innate thing, but it's something in terms of what we've had in terms of access to medical care and being able to get the same types of care. So I think that's part of what we want to tease apart and understand and be able to start remedying and addressing as we go forward.
I just would like to just say finally that my question is, and I hope doesn't probably resemble that, my question has to do with color or anything, but yes, I'm looking forward to if there is any particular, kind of behavior that this community are exhibiting, things that they are not doing. And this is exactly what I wanted just to find out, because I heard that, but I've been wondering until now that you kindly, have responded. I thank you for that.
We have Wayne Benjamin next.
Yeah, there's also
Hi, thank you.
on the Q&A
Right.
after Wayne speaks.
Yeah, thank you, and good evening, Dr. Chung. I wanted to follow up on the question on community outreach. The population that is most adversely impacted by COVID, if you look at Upper Manhattan, and I mean community boards 9, 10, 11, and 12, I mean, a large percentage of the population is there. So is it safe to assume that you have or will also make presentations to community boards 9, 10, and 11?
So I'm hoping I'll be able to get the word out to 9, 10, and 11. I don't have them lined up. I will admit that this is something we're still working on. And Ross looks like maybe he wants to say something.
Thanks, Dr. Tony. Sure, Wayne. We'll certainly work with your counterparts at the other boards, as well as our counterparts at the Morningside, who may have some closer relationship, especially with 9. But a study like this, we certainly want to get the word out and help get folks involved, frankly, in any way we can, because this is a good opportunity, and we need folks to get involved in it.
Right. I mean, if your catchment area is within 25 miles of the medical center, certainly that captures all of community boards 9, 10, 11, and 12. And I would think you'd want to take, proactive measures to make sure those boards know about it and get the word out to their residents.
It's a great suggestion. Thank you.
Absolutely, and even beyond that as well. So if there's a listserv, I don't know if there's a citywide community board listserv or anything like that, that could be helpful to us. I don't want to commit Wendy to 51 separate, or whatever number it is, separate presentations. We'll certainly concentrate on Northern Manhattan, but anything that you could help us get the word out beyond what we might normally think of as our normal Manhattan, we're going to concentrate on Northern Manhattan, but we want to get the word out, as Wendy said, this 25-mile radius.
Well, certainly Gail Brewer's office can be of assistance to you in pulling together the Upper Manhattan community boards.
I just got a text just for the sake of information from Sandra Harris, who's on not a panelist, but as an attendee on her phone, that they have already reached out and that they're still continuing the efforts to outreach to the entire community as much as they can.
Very good.
Thank you, Wayne.
So just so we have Sally and Danielle to wrap up our community board member speak. And then Wendy, there's 2 questions on the chat that we can address regarding recruitment as well. So you can go ahead, Sally.
Thanks for your presentation. I'm glad focusing on the specific situation of our residents. 2 factors. I know that Dr. Alexander Malamed at the medical center and the medical school has done research looking at why Black and brown communities are disproportionately affected, and has tied that directly to their living situation, how many generations might be living in a household. And also the controller has done a report on the number of essential workers by community board district. And I think across the city, we're number 4 in terms of having the highest number of essential workers. I wonder to what extent you are collecting information on living situation, occupation, and those other things that might contribute to a population being at risk.
Sally, those are great observations. And so in fact, we have questions that are related to pre-existing medical conditions, exactly as you said, type of occupation, housing situation. We ask about how many people that are living under the same roof. And those are exactly the risk factors that we were worried about. So incredibly insightful.
The perfect answer too.
And just very quickly, someone asked about blood type A being associated, and that does appear to be correct. I don't know why yet, but blood type A does seem to be associated with higher risk.
Danielle?
Hi, can you hear me?
Yes.
Thank you so much for your presentation. So related to risk factors and social determinants of health, I don't know if you mentioned this, but you mentioned in the presentation that one of the factors that might contribute to folks being more predisposed to getting COVID is not having an insurance or access to medical care. So I was wondering if you come across any of those folks during your study, if you're planning to link them to care at all.
Yes, that's a great point. So one of the things that I think is good about this is that at least for the first 1,000 people, we'll actually get the chance to meet them. So we'll be personally, I myself will personally be part of this. And as we're doing this, we'll be able to understand what the issues are in terms of if they're continuing to have symptoms, groups that we have, providers that we have, comprehensive programs that we have that are offering support for individuals recovering from COVID. So that absolutely is part of being able to connect individuals in the community to individuals in our healthcare center. So that's a great question. And if you have even more specific suggestions, would love to hear them.
Well, thank you for that. I think, yeah, I was just really curious about the extent to which you're planning on trying to assist those folks with accessing care and ensuring that they have, you know, a PCP, for example, somebody that's going to follow them long term and not just, you know, during the study.
Yeah, so I'm very sensitive to that fact. And as we do this, like I said, we do have many programs. I think one of the things that Columbia has been working on very, very diligently in the hospital is about healthcare equity, access, and justice. And so I think we've got lots of new resources available that are going to be very useful to the community in that way.
Great. And then I guess just one more quick thing. I know you mentioned the increased prevalence among Black and Brown folks, and you mentioned the odds ratios, but I was wondering if you stratified it all by zip code. I mean, I know that data is like on a city level, but I think it'd be really helpful for us as a community board to see where we have these hot points, and to be able to potentially do education around that.
Yep. So this is something, and if there's a representative or two from the community board who would like to help us with the data analysis, that would be great. We are planning on actually breaking down, you can break down even more than zip code, but by census tract. And by census tract, there are all sorts of databases that link to different factors with social determinants of health that you can start to tease apart some of these various factors. And so we're looking forward to being able to do that and get into, like I said, even more granular data. And if members of the board can help us in terms of analyzing the data, learning from that data, and then disseminating that information back to the community, that's what this is all about. So I'd love to have volunteers that would like to be able to be part of that analysis team. I'm seeing Sally's already here. So Sally, I've got your name down.
Sally's going to be all over that.
Great. And also the School of Public Health might also be able to assist you because
absolutely
have their internships and
great suggestions. So we've already got a whole core of people that have been part of that in terms of helping us think about how to design this, but great suggestion.
Thank you so much. I appreciate it.
All right, Catherine, do we have anyone else?
No, we don't.
Before we go to public.
Liz has their hands up right now.
There was something in the chat where somebody had mentioned reaching out to tenant groups, and that's going to be, I think, an extra a good resource. So you can contact the community board office to get contact information for RENA and Palante Harlem, and there are a number of tenant advocacy organizations.
That's great. I got those names down. Thank you for the suggestion.
Well, don't thank me. I think it came from Lena.
Yeah.
Thank you. So we're going to open up to the public, Catherine.
1 second. Where did my Zoom go? Sorry, I lost the screen for a second. We actually don't, in terms of the Q&A chat, you mean, regarding the presentation?
Yeah.
So we have just one more from D'Angelo around behavior in terms of, you know, like if you're outside, do you consistently wear a mask? Do you wear fabric or medical grade mask? And if it's relevant to the study at all.
Yep. So another great question. We got to the level of specificity of wearing a mask, social distancing, hand washing. We didn't get down to the specificity of what type of mask. So that is a good suggestion.
And that about wraps up the questions.
One more.
Oh, go ahead.
Steve.
Hello?
Steve.
Yeah, I just want to mention, following up on the point that Wayne raised earlier about reaching out to our adjacent community boards. We're going to be co-sponsoring an event with Columbia next Wednesday August the 5th with the Borough President's office and the other Upper Manhattan boards to talk about Columbia University's plans to reopen. And it will include a discussion about COVID-19 and quote, helping communities follow the latest public health guidelines. Seems to me, Ross, Sandra, this would be an opportunity maybe to also have Dr. Chung make our presentation.
Yeah, we're Steve, thank you. You know, this is all coming together within, frankly, in the last couple of hours. And we've been talking with our colleagues the morning about exactly what the program will be. We have, just following up on what Steve said, we have 3 speakers lined up. Dr. Donna Lin, who is now the COVID director for the entire university. You may know her, she's the chief operating officer of the medical center. Dr. Melody Bernitz, who is head of student health for the entire university, and Dr. Wafa El-Sadar, who is a professor at the School of Public Health and has been on the university's COVID task force. You know, I don't want to put Wendy on the spot because I don't know if you're just hearing about this, but we'll take that suggestion back up and see if we can work it in. Steve, I'm glad to hear because I didn't know that was finalized with Community Board 12. I'm glad that it is, and that's great to know. Thank you.
Well, you can thank Ellie.
Okay, well, thank you, Ellie.
Catherine?
That's
No? Okay, we're gonna give Mark Levine a few words since he's here with us. Mark?
Thank you so much, Mr. Chair. And thanks to CB12, who, my goodness, I think you've been probably the most out front of any community board in focusing on the pandemic for months on end. And unfortunately, that work is going to have to continue. We're not out of this yet. Dr. Chung, great presentation. Great to see you again. This is a really important study, and we need Washington Heights, Inwood, Marble Hill involved in a major way, and really appreciate you reaching out or spending time with the board. I guess I'll just say to everybody, I just want to emphasize the extent to which this crisis is not yet entirely in the rearview mirror for New York. And while thankfully we're not experiencing the kind of surge that other parts of the country are, we're still getting a good 300 cases or more every single day confirmed in the 5 boroughs. More and more that's trending to a younger population, particularly New Yorkers in their 20s and to some extent in their 30s. That's a pattern we saw in other parts of the South that later unfortunately led to greater rates of infection among older adults. And just about every model we're looking at does show an increase in cases starting in the fall for New York. We've got to be ready for that. We've got to use this time to build for that. We've got to build our contact tracing. We got to fix our testing, which is taking far too long in most cases, and is again leaving communities of color behind. So let's take this time not to rest on our laurels, but to do the hard work to get ready for the fall, to address inequity, and to build our public health infrastructure. I know CB12 has been focused on that. I know Steve as health chair is very focused on that. But I just wanted to thank everyone for holding this meeting and for your work on this topic. And I'm obviously here as a partner for you throughout as long as this pandemic lasts. Thank you so much, Mr. Chair.
Thank you, Mark. Catherine?
Okay, if that's it on that part, we will be able to move forward. Actually, and that's a question for Steve. Steve, you mentioned you had somebody who had a quick 5-minute presentation. Are they on the call?
It's Jen Donahue. Is she on the call?
Yes, I saw her earlier.
Yeah.
Oh, I'm not a co-host, so if Jonathan or Ebenezer, if you're on here still, if you can upgrade Jen Don. Oh, there we go.
Yeah, Donahoo.
Okay, got her. So even though we're hosting the idea, and again, thank you so much, Dr. Wendy Chung, for the presentation. You're gonna have a lot of feedback from us, and we're more than, once there's any additional literature for the community, we'll be happy to put that out along with the website, as I shared in the Q&A. So next up on, it's not necessarily on the agenda, but related to obviously public session tonight, and a lot of what started our meeting are noise complaints. So Steve, I'll let you introduce Jen, who will be speaking for about 5 minutes before we usher in the brief public session.
Where is Jen from?
Jen is from a Facebook group, Wahi for Respectful Decibel Levels. And she has done some interesting work on her own to analyze 311 complaints generated from our community during a specific period in July, I believe. But if we could let her go on now, she can explain exactly what the work is that she did and what she found from analyzing the complaints.
Thank you. And Mark, is Mark still on the call? Because it feels relevant for him to be here.
Yes, I am. Hi, Liz.
Fantastic. Thanks so much.
Hi there. Thank you so
Okay,
much,
very
Steve.
good.
And thank you to the community board for allowing me to speak with you today. So as Steve mentioned, I am a part of the Facebook group that was started by Claudia back in May to try to figure out some solutions, for the noise issues that we've been having in our neighborhood. And as you guys have all stated, and we all know, it's like a broken record, like this is nothing new. It's not just the quarantine, but it definitely has had an uptick. So we've been having some weekly meetings just to kind of discuss like what can we be doing to help, help out the community and just, help provide solutions. So what I did this past week is I asked members of the Facebook group to participate in a short data study. So I created a Google form. I had people track from July 17th through the 25th. They sent me their 311 numbers. They sent me their address, intersection, the timing, like just copying and pasting basically what's on the 311 that they've got on their app or through email. And what I did then is I cross-checked that data with 311. So I literally inputted everyone's 311 number into the 311 just to double check and make sure that everything matched with timings and locations and whatnot. And then I cross-checked it with BoardStat, which is what I believe you guys use to help allocate funds and know where the issues are. And what I found was that 38% of this sample that I did for 1 week were not tracking into BoardStat, which I think is quite significant, because if you guys are using that, as part of your resource, then that's a huge amount that's not showing up in there. And then what I did from there is also I tracked, what type of responses, what was the response from the police department from 311. And what I found is that 60% of all of the data that I collected are all coming back unfounded by the police department, meaning, they didn't see they weren't experiencing anything when they stopped by. But at the same time, as you guys know, like people are sending me videos at the same time. Look, it was closed. I have a video of the same time that it was closed. It's still happening. And I know that, there's pressure to close 311 cases out. A lot of us have found that the cases have been closing in less than 10 minutes. I did share all of this research with Steve. I do have PDFs that I can share with you guys. You can see which ones were closed within 10 minutes, within 20 minutes. Clearly nothing was changed, but that's for another day. Sorry, a little loud over here. And then what I also thought would be interesting is just to go back and track and see what did it look like this same week for the last 10 years. I've lived at Dykeman and Seaman for the past 7 years. The first night that I moved in, I was like, oh my gosh, what have I done? And it wasn't necessarily from the restaurants, but as someone else mentioned on the board, it's the people that are coming in and making like a huge ruckus like out on the street. So I was like, let me just track and see, what's been happening in the last 10 years. So I used BoardStat again. And what I found was that even just tracking back for this 1 week from July 17th to the 25th, from 2017 to 2018, the amount of complaints increased by 15.41%. From 2018 to 2019, there was a 63.35% increase, again, just tracking this 1 week of complaints. This year, and I'm sure no one's surprised, it was 180.6% increase. That is massive. We're under assault over here, as you guys know. It feels like a war zone, as many of us are saying. And we're trying to figure out, like, what can we do to help? I love the idea of a public hearing. I think that's a great first step for us to really get all of this out there. I know you guys were tracking like different hotspots. I mean, I did use BoardStat to start to track some of the hotspots, at least for this past week. But obviously, since 38% of them aren't being tracked in there, it's not going to really completely cover all the areas that we're having issues. I was honestly surprised that Dykeman and Seaman wasn't higher on the list. It was actually lower on the list with complaints, which seems insane to me because it's a madhouse over here. But anyway, so that's the data I collected, and I know that we've been coming up with some other solutions. We actually, a couple of us from the community, sat in with Senator Jackson last week. He had a Center in Your Corner, and he seemed very open to the idea of having a town hall, having these discussions, creating a coalition to try to deal with some of these issues. He emphasized that it can't just be, you know, us coming to you guys, to the senators with complaints, but coming with ideas of solutions. We're doing that. We're having weekly meetings where, like, we're here, we're ready to like pitch in and help out. So thank you again for letting me speak today. And I'm excited about diving in more with the public hearing.
Before
Okay,
we
what would you like to say, Liz, before you jump in?
I just want to get a couple of clarifications on some of those numbers. Or if you are you reading from a sheet, can you just send it to me so that I don't have to bore people?
Yeah.
Perfect.
Yeah, I can send it to you.
I'll shut up now.
Yeah, Kat.
All right, so we're gonna head on in. Steve, I just saw you raise your hand. You have a question for Jen, or can we dive into the?
No, I just want to make sure that I just want to clarify something to make sure people understand that what Jen did was look at complaints, not just from Seaman and Dykeman, but from all of Washington Heights and Inwood, that her analysis covered all of our district.
Yeah, I had people from the community. It was, you know, people, they had the Google form. I posted every day, like, all right, we're day one of the study, we're day two. And I had complaints coming in, you know, all times of the day from people all over. It wasn't just at my intersection. It was literally all over.
Did you have a video that you compiled that you wanted me to share?
Yes, we did put together a video. These were videos that, again, the community sent me. We have probably about 100. We obviously did not include them all in this short clip, but that would be great, Liz, if you wouldn't mind playing it. These are some videos from the people in our community.
I like to dive into the public session first.
And
then we can share that as we
Only 1 minute.
It's literally a 1 minute video.
Right. It's a good introduction.
I would have loved to hear about it first, Liz.
I did. That's why I asked about it earlier in the meeting. Are you seeing that?
Yes, make your screen full screen. I mean, make it full screen.
It is full screen.
Ya, ahora lo puedo parar el video.
Okay, thanks, Liz.
No, this is.
Okay, so we're gonna go into, thank you, Liz, for that visual. I wanna remind folks too that we are having a full public hearing to actually dig in deeper and have, I think, more robust
Can-
conversation and ideas.
A question to the chair or other board members.
Can you, is that, who put that video on?
Okay.
I think it's extremely uncalled for.
That happened in the
Especially,
community. I
yes,
hear you,
but
Elliot.
yes,
That was
yes,
disgusting.
yeah, but
I
we're
hear
gonna have a hearing next week in which, given that everything is on the agenda and given that is already presented to the board prior to, is shown again. So moving forward.
So on the list, first we have Tiffany Ernst. And where's Tiffany? You can unmute yourself, Tiffany.
Thank you. I also had some concerns about the noise, and I was talking to Dr. Arlene Bronzeft today. For those of you who don't know, she's an environmental psychologist who is on the board of GROW NYC. She's been appointed to that position under 5 different mayors, and her work in anti-noise advocacy actually started in Inwood at PS 98 in the 70s. One of the questions that she asked me was about crime in the neighborhood and if that's been on the rise lately. And I didn't have the stats in front of me, but it does seem to be. And from my personal experience, for the locations that are recurring noise issues on my block, I have called 911 3 times in the past 2 months. One was for a fight that devolved into a stabbing. Another was a fight where somebody got knocked to the ground and wasn't getting up. And another was a man and a woman fighting over a gun. And she confirmed that there is a link between noise and crime. And she said that when you give license to violate the noise ordinances, you give license to break all laws. And she was concerned about what is going on in the neighborhood. And she has agreed to work with us and with the Group for Respectful Decibel Levels to get these noise issues resolved up here.
What is the name of that expert, please?
Her name is Dr. Arlene Bronzeft.
Spell that?
Sure. It's BRONZAFT.
Thank you.
Sure.
Great. Thank you, Tiffany. Next up, we have Lee.
I'd like to say something.
Is it a question for Tiffany?
Well, it's a statement. First of all, Liz, Arlene is spelled A-R-L-I-N-E. I also spoke to Dr. Branzaft, and I just want people to know that she has agreed to speak at our hearing next week.
Can I have a question? Are we going to have a consistency of who gets called that as a board member? People are jumping in that don't even raise hands. Do we have a process here? Just a question.
We're in the public session.
But people are jumping in. People are jumping in. It's unfair and it's uncalled for.
Can you, is there anything you'd like to say?
Thank you. I know others feel this way.
All
We're
right.
following the rules and we're silenced.
Yeah, we're not, is there anything that you'd like to say? Because
I'll wait my turn. We should have a process and we should all be treated the same.
Yeah, maybe she didn't see your hand. So
It's happened throughout the meeting.
It has happened.
Okay, so I haven't seen you myself. So is there anything that you would like to say now, Gerard?
I don't want to jump ahead. Is it okay?
Unless there was someone before you?
We're in the public session, so customarily board members don't speak during public session unless they
I will
then
defer to the public.
have to clarify why board members aren't being called on. So we have 4 other people on the list, and then we can follow the agenda. And of course, in old business, new business, that's where we customarily can speak.
Thank you very much. I'll ask that no other board member keep jumping in.
Okay, George.
I think that during the public session, customarily what happens is if the board member has a question or is speaking to something that the speaker is stating, that the board members can speak during that time. If anyone else wants to chime in, who is a veteran and has an understanding of that, I would appreciate that.
The question, yes. So Leanne is next.
Hi, can you guys hear me?
Yes.
Okay, perfect. Thank you. So my main concern was about the noise, but I don't want to sound like a broken record. So I guess my main question then will be how you guys as the board members, like what are your actions in helping us? Because there's only so much that we can do. 311 complaints are not working. 911 calls are not working. When I call the precinct, nobody ever picks up. And I've even spoken to the NCO about this, and she's like, I don't know why they're not picking up, which is concerning to say the least. Like, how is a precinct not picking up calls? So we're just all at our wits' end right now. Like, I literally had to escape the city in order to have sleep. That's how bad it is, because it's every single night. Starting at 7 p.m. The latest has been going on until 8 a.m. and I work. And so there's a lot of people. So what are you guys as community board members doing to help us out? Because there's only so much that we can do. And we're all extremely frustrated. And I just want to know what actions are being taken specifically also for Spanish speakers that may not even be, they may not even know that these board meetings exist. So they may not be able to have an outlet for their frustration. So what are we doing to help the community out? What are the actions taken and how are you guys following up? That's my question.
Can you state your name, please?
My name, Liana Rivas.
Thank you.
Thank you.
Hi, Liana. I'm gonna take on that and answer for try and give you the best possible answer on 3 optics. One, as a business owner, I've spent a significant amount of money just boarding up the entrance glasses of my businesses so that they wouldn't get vandalized. 2, my car has been vandalized twice in the past 2 months. So I feel you. I feel for you. I feel as defenseless as you do. What we're trying to do as board members is to try and pass that information along to the authorities that we think are the ones responsible for taking proper action. Has that happened? Obviously, no. We are in the midst of some sort of, it seems like, and I'm just guesstimating, of a power struggle between different agencies who have not taken actions where they need to take action on. And that's what we are in the midst of. We're just like you. We're not, special with human beings with superpowers that can just, with the flick of a finger, just make change. As I said, I'm just suffering probably as much as anyone else in this panel. So we're just looking for answers and trying to call for action. And on the part that we're doing the Spanish-speaking outreach, myself, I've appeared in different Spanish outlets, New York One, some American-based TV channels, trying to spread the message and get people to understand the importance of being active and participate in these discussions and the process of these discussions. So we are taking baby steps towards that effort, but we are trying our best. We're all trying. Catherine.
So I'm just seeing an extra comment. There's a few hands. I did want to, if I could, because I haven't spoken as a member, to add to Liana's point, is community boards don't play an enforcement role, right? So we can't force NYPD, City Hall, any city agency in general, what to do. We can only make recommendations as an institution. What I do value about this space, though, is that it's a great bridge in being able to understand, like, who is in decision-making powers within different city agencies, but also hearing who else and who else you're seeing on the screen that you may not know that are actual neighbors of yours. And I do want to kind of acknowledge as well, the biggest limitation of not being in person right now is that hearing is going to be in English, right? And so we are leaving out a fundamental major part of our community, which is Spanish-speaking elders who are deeply impacted by all of the quality of life issues that we've spoken about tonight. And so I think it does push us to go into the drawing board and thinking about how we can make it accessible, not just for Spanish speaking folks, but just in general accessible for those who have different issues and challenges in terms of the virtual English space. So I want to acknowledge that and say that that's a real thing that hasn't necessarily come up. Sorry.
And I would also extend that question to the elected officials and their staff that are also on the call.
Let's
Can you repeat that? I couldn't quite hear you.
Oh, I was just saying I would extend that question that she had to the elected officials and their staff who are on the call, if they have any
Which question?
input or
The one
insight.
from Liana, or which question is in specific?
Yeah, the one from the public session that just spoke. Was their name
Liana
Yeah.
Rivera.
Okay. Before that, Tanya, since I haven't seen any official raise your hand yet, do you have a question or a comment for Liana?
Me?
Yeah.
Oh, no, I'm with Daryl. I want to hear from the public officials because I agree. I think that that's a role that's been left out in terms of holding them accountable. They have access to the mayor. They have access to the people who make these policies, and they have the ability to advocate for change. If there are some rules, we have a noise ordinance in the city that is not being followed. We have other rules that are not being followed. Prior to Revel being shut down, we as a group were complaining and saying that this needs to be addressed. We were even working on a petition. We have been trying our best, but it's only so much we can do. And I agree with Daryl that we need to start to ask the elected officials why there has been silence. I personally emailed elected officials and their representatives about this noise issue when we were in the middle of fireworks terrorism. And I only got one response, and that was from Senator Jackson's office. That's it. So what I'm saying is that I think that's a relevant question. And I think part of the issue is that I don't think they've been held accountable. I don't think we've asked the pertinent questions to them. I don't think we've asked why. They have much more proximity to the people who make these decisions than we do as community board members. So I would like to know why this is being allowed to go on. And like I said, this has been going on for years. I personally have reached out to elected officials over the years. I've been here 14 years. And I've reached out to elected officials over that 14 years to address this issue. I have tried to address it on both of my committees, from health and environment to the business development. So what I'm saying is that I would like to know where are they? What are they going to do to work with this community board to make sure that we address these issues and get a resolution finally instead of just talk?
Okay, thank you, Tanya.
Gerard, remember Gerard, Sally, hang on a second. Gerard has not spoken and he's been raising his hand.
Thank you, Mr. Chair. Thank you, Mr. Chair. So I just want to offer my own personal experience as a lifelong resident of Inwood. I'm going to give witness to some things that people are aware of and think maybe only in the last 10 years. Some of the things I can empirically offer is that fireworks this year were as bad as in the early 90s. And this is through my conversation with people that have been here for a short period of time, their experience, but also with others that have lived here as long as I have. There is a general belief and sense that the fireworks this year and it's been starting even this previous years, but this year was worse than any year anybody that has lived here for 30, 40 years can ever remember. The noise and public disturbance are as bad as the early 90s when people were starting to become concerned about living in this wonderful community, which still remains to be a wonderful community. When I speak to many people that have been here for a long period of time and some that have not been here, generally are increasingly feeling less unsafe. We feel that there is more to be concerned about when we travel to trains in the morning or to our buses or from our trains and buses. And there's a general sense that we are being abandoned by our leadership, that our leadership is not stepping up and being out there in voicing and standing up for our concerns. And I'm going to ask our leadership as a lifelong resident and for people that can't speak right now to please don't abandon us and step up here and take care of business. And that's the leadership. And I thank you all.
Right.
Okay, thank you. We're gonna keep going. This is one of the few opportunities the public session has to speak.
My comment is related to the speaker who just spoke.
To Liana, okay.
Okay, your answer to her, Kathy, was unfortunately we can't reach the Spanish speaking audience. We have done that at hearings in the past. And also Columbia University has managed to hold Spanish and English Zoom meetings. I wonder why we can't. I think that's a huge oversight on the community board's part. And I think that we need to do our damnedest to make sure that all our community is heard. It's unacceptable to say we're doing this only in English.
Right. And I'm saying it just because it hasn't been publicly said and it hasn't been fully, it's still in discussion and being planned. That's why.
Okay, it needs to
Not
be,
because it's a refusal on our part.
okay, it needs to be, we need to address it. It's not enough to say that we can't.
Okay, Bernard Groman has had his hand up for a while.
There are a few questions in the Q&A.
Can you hear me? Okay, you can definitely hear me.
Is that Bernard?
Yes.
Okay.
Okay, so I guess, first of all, I called up Mark Levine's office to complain about the noise. I moved here last year, so I'm a relative newcomer. But last year, every once in a while there was some noise, but it was okay. This year, it's unimaginable. I had, on July 4th, I had 2 parties, one on each side. I had it in stereo over here, one louder than the other. I mean, literally the volume of like Yankee Stadium with the Rolling Stones, shaking stuff in my apartment. Fireworks within a foot of the building. Okay, and until about 3 o'clock in the morning. And since then, every Saturday night till 3 o'clock in the morning. Every Saturday night, and there is not a restaurant over here or anything. It's in front of a beauty parlor. That's what's going on. I've called 311. I've done everything. It's same results as everybody else. I have been speaking to the NCO in the area. He actually has come around and done something, a little bit, but not much. And it's the same car. I have the license plate number of that car. It's the same speaker in that car all the time. It's real simple. Enforce the law. Give the guy a ticket and confiscate the speaker. That's all you got to do. It's not rocket science. It's not rocket science. And do it. You don't have to do it to everybody. Just do it, and people will stop doing this. It's as simple as that. The ticket goes up to $1,000, and plus they lose their speaker. Okay, I mean, you know, it's really easy.
Well,
and yet somehow not easy. Okay.
Okay.
I mean, and I was so frustrated. I started a Twitter account and started posting my videos of the party, and I got this story on 1010 Wins yesterday. And there's going to be, as a result of that, they're going to be asking de Blasio a question about the noise up here, hopefully, at one of the press conferences.
All right.
Eliezer, I can speak to that.
Do you have anyone else so they don't feel like we're being jumped over?
Yeah,
Barbara,
we
I'm
have a
sorry.
few people still waiting to speak. So Andrea Arroyo is.
Unless they've spoken, then let Barbara be the first one because she hasn't spoken yet.
No, these are community members.
Okay, so yeah, please go ahead. Sorry, Barbara. I don't want to jump anyone ahead.
Hi, can you hear me?
Yes.
Hi, thank you. Hello, everyone. So I live on 159 on Broadway, and really the noise violence is just unbearable. I mean, I want to say this is not only about noise, it's basically about justice. The one thing that, you know, many people tell me is that the noise issue is kind of a cultural divide. And I want to say that that's just definitely not true. I am part of the Latino community, and we do not condone the extreme noise. In fact, we are the victims of it. The Latino community is, of course, a hardworking community. We deserve to live in a healthy environment like anyone else, like everyone else. Blasting music at extreme decibels is not culture, is noise violence, and it fosters really a lot of anxiety and a lot of fear. You know, when people tell me about culture, my answer is, you know, music is culture, yes, of course, but it is culture when it contributes to the cultural life of the city, and when it's used to foster community building. So I think ending noise pollution is basically about justice, because we all deserve to live in an environment that is healthy. And just speaking of impact on a personal level, the loud music, I mean, my window shake, my walls shake. I'm on the 5th floor and I still can hear it. The explosions, the music, imagine just that constant assault of noise on a baby trying to sleep, on a teenager trying to, do homework, on a nurse, after a double shift trying to get some rest, on someone with PTSD, on an elder with anxiety, on anyone really with health issues, on anyone in mourning. I mean, we're on COVID pandemic. We lost so many people in New York. People are mourning. And on all of us that we're just really basically trying to survive in what is already an extremely stressful time. So what I think is that a small number of individuals and groups are victimizing most of us and are making this beautifully diverse community divided. And I really want to foster a sense of community so that we all fight for what is right and for living conditions that are healthy for all of us. And the last thing is that we need to address just this noise issue as a public health issue and as an environmental justice issue. So thank you.
Thank you, Andrea. Next up, we have Claudia Shire. Sorry.
Yes, hi, good evening. Thank you so much for taking me to speak. I wanted to introduce myself. The group Washington Heights and Inwood for Respectful Decibel Levels is the one that I founded. I'll try to speak a little louder. Is this audible? Thank you. So I founded it on I think about May 20th because I was working from home. I am a musician, and of course all my concerts were canceled, all the teaching was canceled. So I was trying to teach violin lessons on Zoom at home, and I couldn't hear my students because there was a car outside playing about 50 feet away, playing the music so loudly. And so eventually I went outside. I called 311, nothing happened, complaint closed. Called 311 again, nothing happened, complaint closed. And I want to say this is before George Floyd's murder. This was just as the weather was starting to get hot. And so it went on for 8 hours, and I didn't understand why. And so I thought I will reach out to other community members and see if we have similar experiences and try to find out what's going on. And I thought, okay, this is probably just a small thing. I've lived in Inwood since 2003. I love this community very much. I have been here in the summers. I have been here on July 4th. It's been fine. It's been loud sometimes, but it's been basically livable. But this year was something else. And so I reached out, and without knowing what I was getting myself into, people joined, and more people joined, and more people joined. And today we're reaching 600 people altogether who have joined the group. So that's a huge amount of people. And you should see the videos that we have. So I've tried to be very diligent about keeping the group somewhat organized. So we have probably 100 videos of all the different noises that we have here. We have, of course, fireworks. We have the motorcycles that don't have mufflers. We have the racing cars that don't have mufflers. We have the slingshot cars that zoom around all night. Last night for 4 hours, I could hear the tires screeching and hear all of this. And we've also had discussions. Should we go down and talk to our neighbors? That can be helpful when you know your neighbors. It's very hard to talk to somebody who's racing a car. I'll just say that. So, so we have all these different types of noise, and some of the noise is linked with each other. Sometimes you see the motorcycles and then you see the fireworks happen after. I was stopped when I was trying to cross the street by somebody who wanted to sell me drugs, probably thinking I was I was a customer, and I said, no, thanks, I'm just crossing the street. So all of these things come together, and we have a general sense of lawlessness here, a sense of public insafety, a sense of fear about all the lack of social distancing. a lack of being able to sleep at night, a lack of being able to work. I should mention that we have a Spanish language section of our group now as well, and Liana, who spoke earlier, is actually leading that section, so we have many Spanish speakers, and somebody reached out to me today, and she actually wanted to speak today, but she was worried that she might not have somebody to translate for her. Her mother passed away, her 83-year-old mother passed away after having an anxiety attack from the fireworks on July 4th. And so I just think that is, I can't imagine if my parents passed away, survived COVID, but passed away from the fireworks. And she said, you know, if I go into the community and I walk through the street and I see, you know, I pass people and I think, were they the ones who set off the fireworks? You know, it's just so sad. And so I want to, I realize I'm talking a long time, but I want to thank you very much for holding the public hearing. I think this has really affected our entire community. I hope that we can do something to reach out more to the Spanish-speaking community as well. And I really just want to thank you for putting us on the agenda for next week.
Yeah. Can you repeat the name of the Facebook group just so that Liz has it for the chat and also somebody in the Q&A asks?
Yes, we have two. So there's the English one is Washington Heights and Inwood for respectful decibel levels. And the Spanish one is a translation of that, Washington Heights and Inwood. I think the shortening is Wahai and Inwood in both cases, and please pardon my pronunciation, but niveles respetuosos de decibeles.
Thank you, Claudia.
Thank you.
Sorry, we have two more folks. So we have Joel Abreu.
Then Barbara will be the last.
And then Philip, sorry. I'm just looking for Joel. There you go. There you go.
Promoted him? Was he promoted, Kat?
Yes, he needs to unmute. Joel, if you unmute your mic, we should be able to hear you. It comes up muted. There you go. Joel? He mentioned earlier he was having issues, so I'm going to move on to the next person. And if you can get that fixed, just raise your hand. So next up we have Philip, who's actually from Shimani Williams' office. Where you at?
Right. Hey, good afternoon, everybody. I don't want to really speak out of turn here. I can wait later on to make any updates or share what's going on, but I just wanted to take a moment to acknowledge that you're representing the public advocate, Shimani Williams. And I'm actually notes. I'll finish so Joel can finish so he can talk. But I'm actively taking notes, and I'm going to bring it down. And I'm sure as Elazar can tell you, we've seen some people argue you've seen a slowdown in what you're seeing here, 911, 311, and the police precincts is happening all over Manhattan. But there's a particular violence uptown that's taking place. And so I just want to let you know that I'm going to go back and make sure the public advocate in our office knows and be in touch with LSR and other board members I know, like Curtis and Domingo and anybody else, to touch base on this really, I heard the woman saying that this is a form of violence. So make sure this is really understood. Thank you.
Hi. Yeah,
Joel.
can you guys hear me now?
Yeah, we can hear you, Joel.
All right. Sorry about that, guys. I was on the call and I was also on the Zoom app. I apologize. My name is Joel Abreu. I've been living in this community all my life. Literally, I'm 29 since I was born. And I think I'm listening to a lot of the public speak and a lot of what you guys have to say. And what it is it's a microcosm of what's going on a national level. The police, a lot of my family members are police. The police have their hands tied. And the reason why the police have their hands tied is because of politics. It's politically motivated. There's a movement going on. I don't know what you guys call it, defund the police or whatever it is, that causes the police to have inaction. So because, and one of the ladies spoke about this, it's about justice. So when somebody lets off a firecracker or is on a motorcycle or is racing, the people who are supposed to enforce the laws are not there because their hands are tied. So it becomes a problem where none of us can solve it, right? Because it comes from a part of this system that is almost unreachable for us, because the media, our political leaders are all backing this movement to defund the police, this Black Lives Matter movement. These movements, what happens is that they aren't able to enforce the laws that keep our neighborhoods safe. So de Blasio, Democrats, all these progressive, I don't know what to call them, right? Affiliations fund this movement, which then in turn make the police not enforce these laws, which makes our neighborhoods unsafe. It's simple. You stop these movements, you put different political leaders in power, which then gives power to the police to enforce these laws against firecrackers, against motorcycles, against all of this, against all the noise complaints. If you stop giving people, the police, this power, they aren't able to enforce the laws. Anyways, that's what I wanted to say. My second thing that I wanted to say is I've been living here for 30 years and it hasn't been as bad, but it's always been. That's part of our culture. Dominicans are loud in general, right? So you're gonna hear music, you're gonna hear motorcycles, and unfortunately, that's not gonna stop. That's not something that's gonna stop. Obviously, you can control it a little bit, right? And some of the solutions that people are looking for are not gonna happen, aren't really realistic. So a lot of the solution is to move out, to go to a different neighborhood. That unfortunately is not gonna be something that's gonna be quiet, because that's not within our culture. A lady mentioned it, that it's a cultural divide, and it is. Most Dominicans like to be downstairs and listen to their music, and it's okay as long as it's respectful. But it's not going to stop unless we put different political leaders in and stop political movements that tie the hands of police, that aren't able to enforce these laws. So that's what I got to say.
Catherine?
Thank you, Joel.
Yes.
Go ahead, Alyssa, I'm sorry.
No, who's the next person, and then because Barbara's been waiting in turn for a while.
Yes, we have several hands from board members. So
Barbara will be the first one, because I think if we've already spoken, we have a lot to speak about next week, and we have so much more. Thank you, Liz, for second that. We have so much more that we can discuss.
Hey, can I please make a comment? I can't live with
Well,
myself.
I know, as long as Barbara has been waiting.
Was actually raised from a lot longer ago and it was lowered.
Okay, Barbara, you're next.
Yeah, I don't know who lowered it. I certainly didn't.
No, this is the public session for the public to speak, not the board.
Exactly.
Fine, so let the public finish.
Right. And so you're right. So what Eliezer is saying, the public session has ended based on the hands that we took at the appropriate time. Again, I know that there are a lot more comments and we have gathered them. In the Q&A, we were adding Ebenezer's email. So if you have specific cross streets of incidents or videos, please send them, because we are compiling a log, not just for the hearing, but also as we coordinate with other city agencies. So there'll be more information on that. So Eliezer, if you're moving into new business, old business, or are we doing the calendar first before we take hands from members?
No, I think that we want to, it's 8 o'clock, it's 8:10. I think that we have so much to discuss. We would like to end it here. Barbara, just for the fairness of it, since you've been waiting, I'm going to allow you to say something in a few minutes, and then we're going to call it a day, and then move on in, unless you have anything else that you want to add.
No, it's not on the agenda. We don't have new business.
Okay, good enough. So Barbara, please.
Yes, I believe a man who spoke a few ago about the party outside of his house and how Wynn's radio is picking up on it, and that they're going to bring de Blasio to task is really the essence of the problem, because the police, who are generally the who engage in enforcement, work at the behest of the civil authorities and take their marching orders from the civil authorities. For example of that is the ending of stop and frisk at the direction of the mayor. Similarly, in this situation with the noise violence, the mayor has said very clearly that the police are to focus on more violent crime and are not to direct their energies to these issues which he sees as less important. We do not. We are really under siege with this. And this comes from de Blasio. So the police have been ordered not to write summons, not to confiscate radios, not to, which I fully agree with, they should be, not to confiscate boom boxes that are in the boombox speakers that are in the backs of cars, which they have done in previous years. Now, I believe that for our forum on August 4th, you should have the mayor come, and also the speaker that was here from Jamani Williams' office, our public advocate, said strongly when this noise violence really was kicking up, he said enforcement should focus on the distributors from out of state that are coming in and not on the low-level people on the streets, and that instead community groups should engage those people and talk to them as community groups. And of course, we know a woman was shot dead on the streets of Brooklyn. Not really a great idea. So that was the message that was sent out, and it comes from the mayor's office. So, and the NYPD has had their hands tied behind their backs. So if we want to have an effective forum, what we need to do is have de Blasio and his deputy mayors and our public advocate, Jamani Williams, come and say, we want, and reverse their positions and say, we will call on the police and authorize them to write summons, confiscate boombox radios, confiscate illegal speakers. Many of these speakers that are installed in the backs of cars are illegally installed, and so forth. And that will take care of the problem.
Thank you, Barbara, for your comments.
But it's from the mayor's office.
We're gonna move along to the review of September's agenda. You guys understand it's Labor Day weekend. So those of you guys who would like, yes, Liz.
Do we have items of new business? Or,
Yeah.
I don't think.
or does new business come after the calendar? I'm sorry, I don't have the agenda in front of me.
It's all right. Yeah, the calendar comes first.
My bad.
Okay, no problem there.
Sorry.
Our calendar for next meeting in September. Those of you who would like to move their first week over to the second week, if you don't have it in front of you, please reach out to Ebenezer. Ebenezer, make the necessary arrangements and distribute them accordingly. New business, does anyone, I don't think we have anything for new business.
Eleazar, one second before we move from the calendar. I want to call to the attention to all the committee chairs here in the meeting is that we must to start our calendar, September calendar, before the Labor Day, because we have like 4 days of meeting before Monday, the Labor Day. Usually we start after Labor Day, but this year we have to start before Labor Day. And also we need to find a date for the executive committee meetings because the third Monday is the day, the Monday before when the executive committee should be, is the day before the general meeting for September. That was the reason I want to have the discussion of the September calendar. We can have it offline if you want to. This just made a decision the date of the executive committee, and also to ensure that everybody is aware that we're going to start our meetings before the Labor Day weekend.
So just
yeah, Curtis?
Does that mean
first.
that's so? I'm looking at the calendar. That's September 1st to the 4th are the first days before Labor Day. So you're saying we should start our meetings the either the 1st, 2nd, or 3rd. Is that what you're saying?
Yes, because we don't gonna have enough time after Labor Day to accommodate all the meetings, to have 1 or 2 meetings per day.
Got it. I'm emailing you now.
So I usually meet on the second Tuesday, which is going to be the day after Labor Day, and I'm fine with keeping my meeting on September 8th. And I would suggest, even though we usually have our executive committee meetings on Monday, I would suggest that we have our executive.
No, I'm deliberately not. Oh, good, Gail's there.
Hello. I would respectfully request that we have our executive committee meeting on Tuesday, the 15th, or Wednesday, the 16th, so that it's in enough time for the general meeting on the 22nd. So I just wouldn't do it on the Monday, because if we have it on the 14th, that's going to be the second Monday. It's going to conflict with whatever usually meets on the second Monday.
I second that. Is that a motion or just a change?
No, I would suggest that tomorrow, Ebenezer, can you send out like a Google poll for all of the members of the executive committee to see which date is best, the 15th or the 16th, and then whichever date is best for the majority of the executive committee, that's the one that we should go with, I think.
Okay. So that'll, Ebenezer, is there anything else that you'd like to?
No, I will do that. The conflict is with the executive committee. We need to find a date for that one because that's the one that is up in the air because of the general meeting is the day before according to the calendar.
Okay.
Right.
And make sure that all the committee chairs understand that we have to start our meetings before the Labor Day weekend.
Okay, thank you.
So are you going to send out that Google, some kind of?
Yes, I will send that tomorrow. I will set the calendar and a poll.
Thank you so much.
All right, thank you. Before I, call the meeting to order, I'd like to.
I have two items of new business.
Sally, just give me a quick second. I'd like to, point out first the letter that Congressman Adriano Espaillat was able to send to DMV, which led to Rebel pretty much ending their operation in New York City, at least for the time being. So I'd like to acknowledge the fact that Congressman Espaillat was on top of a situation that is affecting us all, more than others, but it has been a troublesome situation for the community as a whole. I know that Gail was just here listening, but I would like to have her at least say hi to everyone. Gail?
Just listening, I want to say the main issue that we're focused on, schools and schools and schools. And I want to thank you, Mr. Chair, for participating in the discussion with the food czar about everybody getting $420 on their card if they already get food stamps. And if they don't, please don't throw out your junk mail, because up with $400 per student in the public schools in the very near future. And then we got to figure the school. I don't think the school should open, and I don't know if that's something that the board is going to take up, but we have to figure out opening or not. How do we make sure that if it's virtual, we need a better system than what we had last semester? So I'm just going to leave it at that because I know there's a lot to discuss. I know that the Department of Sanitation has cut the litter baskets on Sunday 100%, and they've cut pickup 65% during the weekdays. That's also an issue. And I those two in particular, not to mention many others. I want to say thank you. Keep talking because you're having a.
Thank you. So new business before we call the meeting to order. Sally, I think you had a few things that you wanted to say.
Yes, I have two items. The first, I appreciate the board setting up a public hearing about the noise violence and the health risks associated with that. What we have not yet addressed is the public health risks that we have by the lack of social distancing, face covering in our neighborhoods. I think it's an economic matter. I think it's a matter of education. There are both at a city and a state level issues, for example, with the restaurants can be addressed by the mayor's office of special enforcement. At the state level, Cuomo now has a task force. I think that we need to address that in a separate public hearing. That's item one. Item two, as you may or may not know, the hold on the inward rezoning is now not a hold. It's back on in full force. We've been requesting that the promised inward task force be assembled. It needs to be assembled and it has to be approved by a vote of the full board. We're already behind the 8 ball on that. So my request right now is that we address it immediately. We should have been working on it for the last year. We haven't been, but we can't wait to discuss this in September. We need to start now or yesterday. So that's my other item of new old business.
Thank you. Thank you so much.
Because if it's a motion, I'm second.
I'm making a motion. I am making a motion that we impanel an inward task force to address the rezoning issues. I think it should include representatives from every committee.
I agree.
A diversity of membership representing different neighborhoods, expertise, et cetera. It affects every single community and we need to get on it yesterday.
I second the motion.
I already seconded that. We got multiple.
Third.
That being said, my hand has been raised for quite some time. It's in relation to the public hearing that we're expecting to happen on August 4th.
There's a motion on the floor. It needs to be voted on or discussed if there's, and then vote.
Before we motion to end the meeting, I wanted to register that.
There is a motion to end the meeting.
But we have a motion on the floor that sounds.
But we almost just ended the meeting and my hand has been up for a while. So I want to make sure that I'll be able to speak before that happens again. Thank you.
Can we take a vote?
Call the roll.
Okay, hold on a second. I didn't realize that we were going to be calling the roll. So if it's not a total breach of protocol, is it okay if, oh, wait a minute.
I don't have a roster, so I can't help you, Liz.
I got it.
Liz, you need one of us to go on the participant.
I got it. Hold on, file, save as, what's today's date? It's the
28.
Okay.
Could you repeat the motion that Sally just made and was approved, as we're all clear on what the items were that was to be included?
There was just one motion in reference to start or restart.
We never had one because it was never approved. The motion is to impanel the Inwood Hill Task Force, the Inwood Rezoning Task Force, that it include representation from every single committee in a diverse process. That's representative of our community, also representative of each committee, because this is a matter that affects every single committee of the community board. And so that will be the way that we liaison between this task force and the individual committees.
Thank you.
Including businessmen who are probably the most affected ones by the rental increase.
The Business Development Committee.
Of course, that'll come from as they're assigned, not just from the business committee. We need outside people as well too on that task force.
Yes.
Is there discussion?
There was actually an original discussion that outlined exactly how this should be created, including what Eliasal just stated, as well as other members that have been involved in the Inwood rezoning process.
Great point, Aisha.
Okay.
And I would like it unencumbered by the intrusion of any elected official into who gets appointed to this task force. It needs to be diverse. It needs to represent this community. It needs to represent people from Inwood, and it needs to be part or separate from influence, because that happens way too much.
I second that.
Okay, calling the roll. Mariella Ali, Okay, so I'm gonna ask, can you,
If you're not taking attendance on the community of the whole, then
I have taken attendance, but
you don't need it
but
technically.
calling the roll is a useful way of making sure that I didn't miss anybody. So Mariella Lee appears to not be on the call. Richard Allman, how do you vote? Is Richard no longer on the call?
He's been in a, he's had
I just unmuted myself. The answer is yes.
Okay. Francisco Alvarez, is he on the call? No. Mary Anderson.
Yes, I vote yes.
Thank you. Glennis, I don't see Glennis on the call. Wayne Benjamin. Wayne?
He's no longer here.
Okay. Jim Berlin.
Berlin's here.
Jim, how do you vote? Can you unmute yourself, please?
I think he left at 7 o'clock.
No, he's here.
He's back.
See you.
I don't see him.
He said he was gonna leave at 7. I don't think he's here.
Okay, well, I see that there's still a box that says Jim Berlin.
Hello, I'm here.
Hi, how do you vote?
I didn't hear enough of the discussion, so I'm going to abstain.
There was no discussion.
Oh, what am I voting on?
You're voting on whether or not, so the motion by Sally was that the Inwood rezoning task force be impaneled and that it include membership from every committee and representation of diverse constituencies of the community, unencumbered by politics.
And might I ask how most other people voted?
So far, Richard Allman has voted yes. Mary Anderson has voted yes. Mariella Lee, Francisco Alvarez, Glennis Aquino Gill, and Wayne Benjamin are not on the call. You will be the third vote. How do you vote?
I'm going to abstain for now.
Okay. Tanya Bonner?
Yes.
Eleazar, oh no, I called you last, my bad. Daryl?
Yes.
Is Nobles on the call? No. Robin Cruz, not on the call. Waldis Cruz, not on the call. Gerard?
Gerard's no longer here.
Kathy?
Yes.
Is Naisha Diaz on the call? I didn't see her.
No.
Domingo, I didn't see him. Gabby?
Yes.
Ashley Fernandez, I didn't see her. Sally?
Yes.
Barbara? You're muted.
Unmute yourself.
I'd like to have a friendly amendment that especially.
No. You cannot have a friendly amendment. It's already on the floor. We are voting. You may vote yes.
Okay, yes.
Thank you. Faith Florimon.
Yes.
Thank you. Mariella Graham.
Yes.
Juan Guzman. Is he on the call? I didn't see him.
No.
Marion James. Danielle.
Yes.
Leo Jimenez.
He votes yes. I have it on the, he just texted.
Okay. Yosef, not on the call. Aussie. I got the S.
Yes. I'm sorry, I can't yell.
Oh, honey, what time is it where you are?
3:30 in the morning.
Hi.
Oh my God.
Yeah, she's calling in from Israel. I can't believe you're even here. You get extra points. Eddie, how do you call? Just give me thumbs up if you can unmute or thumbs down.
I vote yes.
Oh, excellent. Francisco Lopez. Francisco, you're
Not on the call. Not on the call.
Well, I see a box that says Francisco Lopez. So he's still on the call, but I'm not sure what happened to him. I vote yes. Maria, how do you vote?
Yes.
Cindy Matos?
I don't see her.
I don't see her. Jay Mazer, I don't see him. Cedro?
Yes.
Thank you. Ariel Miranda?
I vote yes.
Is Debbie Nabavian on the call? I don't see her.
No, I've arrived. Yes.
Okay, thank you. Jonathan Rometta?
I vote yes.
Thank you. Aisha?
Yes.
Rosie?
She's not here.
Not on the call. Paradise? She was here.
Yeah.
Did she drop off?
No, can you
Oh,
hear
there
me?
you are.
There.
How do you vote? Yes?
Yeah.
Christina?
Phoenix.
Christina,
she said-
not on the call.
Cuando anunciaron que murió, en donde
Maria, can you please,
Mute yourself.
Bruce,
Aye.
how do you vote?
Yes.
Thank you. Is Etta on the call?
Yes, and I vote yes.
Thank you. Steve?
Yes.
Omar?
Yes.
Angel?
Yes.
Chris? Chris Ventura, can you unmute yourself and let me know how you vote? Can somebody text Chris? Because he seems to still be on the call, but his screen isn't showing a picture and he's not talking. All right, I'm going with left early. Curtis?
Yes.
Eleazar?
Yes.
Okay, is there anybody that I did not get? Going once, going twice. If you are a member of Community Board 12 and I did not call your name, please let me know. All right, the vote passes.
I would like to change my vote to yes, if that's possible. It's Jim.
Absolutely possible, and I had a funny feeling you would do that, which is why I was vamping for time. The vote is.
Thank you.
You are welcome. I know you a long time, my man. The vote is unanimous.
Thank you, guys.
All righty.
There was
Said
another
I-
order of
I-
item of new business.
Thank you. Yeah, Aisha had a few words before we call the meeting to order.
So quickly before I go into my true point, I wanted to reiterate that previously, I don't have the resolution in front of me. The Housing and Human Services under my leadership put forth a resolution that was voted on by the board and passed, which spoke to the fact that agencies should be restricted from acting during the summer months when we are normally supposed to be on hiatus. I do not know that any of the chairs that have been in position since that resolution has passed has actually worked on that. I understand that we are in different times, and that is the reason why we have continued our work during the summer, but that does not change that that resolution needs advocacy. So I wanted to bring that up. If there are any questions about which resolution that is, I have no problem providing that. That being said, I believe that in the context of the August 4th hearing of noise complaints, that we should have this be a part of the discussion and possibly representation to people who can speak to this. I did a training with the defund police movement 2 weeks ago, a 4-day training. And I feel strongly that there are voices in that space that are doing incredible work, specifically in regards to transformative justice, and that should be brought into this discussion so that we can devolve solutions that can rightfully address some of these problems that we're having without criminalization and policing being the primary part of that discussion. Also, I'd like to add to that, that Columbia University, which is near where I live, also contributes to noise issues. So this is not only about fireworks, this is not only about speeding cars and motorcycles, but it's about noise in general. And it seems to be that only certain types of concerns raised to being a high priority, while others are swept under the rug, especially when we're talking about specific institutions in our community. I'd like to see that be also on the agenda. And when I say that, I speak of the gate rattling at all hours of the night, having deliveries being delivered from large trucks idling at 3 in the morning, et cetera, and so forth, and honking for hours at times because they're blocked in, specifically because Haven Plaza was put in their way. So that being said, the last thing that I want to add to that is that I believe that someone should be available to unpack the numbers. The reason why I said that is there's a study that was done on noise complaints that were issued in the 138th and Broadway Street area. A friend of mine's grandmother lives on that block. She's actually the wife of one of the Mirabal family. And on that block, historically, there's been like domino playing because I grew up there. I've known it, I've seen it. As the neighborhood began to change, specifically gentrification, that specific domino table began to get a like 1,000% increase in complaints. So while I'm extremely sensitive to my neighbors, I'm sensitive myself with noise that I experience. I do feel like there's been an uptick as far as the firework noise this year. My son has hyperacusis, which means he hears extremely loud in one ear. So we would be a family that would be extremely sensitive to that. That being said, we cannot assume that the statistics of the complaints is equal to the activity, because it simply can be a campaign at times, right? And I'm not saying that it is. All I'm saying is that if we are doing things fairly, we will have someone that can unpack the genesis of those numbers appropriately in that space and that discussion as well. And I think that can benefit all. So thank you.
All righty. Unless someone has anything specific that they want to say before we call the meeting to order.
I do quickly.
My hand was raised. And
oh, I'm sorry, I didn't see it, hon.
Oh,
Go
no,
ahead.
no, I wanted to make sure. So I just wanted to clarify that as we heard tonight, several people may address this noise and quality of life issue complaint, and there was a young man who spoke, and I just wanted to clarify a few of his statements. First of all, there is no correlation with the Black Lives Matter movement, and it seems to be a little bit, how can I say this, but politely, I won't even try, but it doesn't seem to be true to kind of connect these two issues of the police of the movement that's happening around the country, what's happening with noise complaints. Yes, there is there's a lot of correlation, but these are deliberate decisions that are being made by the NYPD to not respond to the concerns of the community. Last month in my public safety committee, it was stated on record that there was a concerted effort by some particular officers to not respond to the issues in the community because of their concerns about how to interact with people if they were to go into and confiscate a stereo, what that would lead to. That could lead to an altercation that could escalate, that could potentially become something of a larger concern. So that is the issue. It's how do we figure out a way, as Aisha mentioned, to transform. We don't want policing to around, arresting people for these infractions, but what happened? But to figure out a way to think of this holistically and come up with a solution that is transformative and restorative at the same time, but also holding the NYPD accountable for their lack of interest in engaging in this conversation and their lack of response to this particular issue. Not just the mayor, but the mayor, the NYPD, our local elected officials, and even our community board, who is not an issue of just the businesses either. We've heard that tonight. I know several people have said it's people coming from other locations coming into the community, and I don't think that's completely true either. I think yes, there are some people coming in, but there are definitely people in the community. I've walked around the community to observe some of the complaints that I've received through my committee, and these are people I see doing the same thing over and over and over and over and over again. We have to remove the false narrative. We have to hold people accountable, and we have to accept the reality of the situation for what it is. Thank you.
Can I just
Well,
ask a
well
suggestion?
said. Well
hang on a
said.
second. Hang on
Can
a
I
second.
suggest somebody to come to the
Hang on.
meeting?
Hang on a second. Phoenix, were you trying to say something? Because I really want to call it.
Yeah, really.
Call the meeting to order.
Can you hear me?
I have a suggestion for
So
somebody.
wait, give me a second, because Phoenix was already speaking.
Oh, I'm sorry, Phoenix, but thank you.
It's okay. Can you hear me?
Paradise.
Yes. Yeah.
I wanted to agree with Curtis and hearing people say that they were calling 911 on.
Can't hear you.
Can you get closer, maybe?
I'm sorry. Can you hear me now?
That's a
Yeah.
little bit.
A little low.
Yeah, I'll turn off my air conditioner. But when I like hearing people say that they were calling.
I'm sorry, I can barely hear you. You're gonna have to either get one of these or really get really close to the mic.
Can you
Phoenix.
hear me now?
No, yes, now much better.
I wanted to say that I agree with Curtis, and hearing that people were calling the police on people who were making noise makes me a little concerned given what's happening right now. And I'm not saying I don't think anyone should be called. I think we should work on finding an alternative to that. And I wanted to respond to the man who said that, I don't know if he's still listening, I hope he is, but he said that the reason why there's a rise in noise complaints is because of Black Lives Matter movement and the calls to defund the police. I think the whole point of defund the police is to find alternatives to calling the police on nonviolent offenders, so we don't end up, so people of color and Black people especially don't end up losing their lives when it's not needed. So I just wanted to respond to that and say that when you make assumptions that are not based on facts, like saying the police are scared of Black lives, are afraid to take action because of Black Lives Matter. I think language like that is really violent, and we should denounce it, because it's honestly offensive to me because I support Black Lives Matter, and I think we should defund the police, but what that man was saying is not at all what we support. So yeah, that's what I want to say.
Thank you, Phoenix. I just like to, before we finish our meeting, to say, yes, we do have an extremely amount of noise. I've heard comments of people say that it's a cultural thing. Even if we share the same nationality, that doesn't necessarily mean that we are all alike or we behave the same. I think that some of us are just as big of victims as the people who have had the opportunity to express their opinions. I think that we are making an effort to try and gather as many voices so that those people who should be held accountable, regardless of who they are and what agency they work for, and whether we should abstain ourselves from voting on resolutions that affect the agencies that we work for, I think that we are on the right track. I am very proud to say that a lot of the violence that has been happening throughout the city, regardless of the amount of noise that you guys have heard, is not happening in our backyard. Not a single homicide, not a single stabbing, none of that nature. Yes, there is a lot of noise on firecrackers, but no homicides or no violence. At least something is positive is come out of this. So I'd like to call the meeting to order. I'd like to get
I'm sorry, I wanted to suggest somebody to come to the meeting, and I've been trying to say that for the August 4th hearing. I wanted to suggest that we invite Beta NYC because they are the ones that gather this 311 data. They manage that 311 data for board stat. And I wanted to suggest that they are invited along with the Office of Special Enforcement.
They're on our
So
list.
that they can be a part of the August 4th discussion. I just wanted to make sure you all heard that so people can get on. I have the contact information. Yes. happy to share. Thank you.
Okay, thank you.
Maria's hand has been up for a long time.
I know. I just have an announcement after
Oh.
listening about the noise and everything. You should have been in the Bronx on Saturday afternoon, coming out of City Island. There was 1 million people honking, you know, the cars, and it was a mess. We have problems here, but we should look at the other boroughs, how people are misbehaving. But also, let me just say my announcement. Can you hear me?
Yes.
Okay, I have a few hundred masks, blue masks available for donation, but I want to make sure that I know who I want to give them to. Not everybody's gonna line up in front of my house, you know, asking for the mask. So give me a call. You all have my telephone number. I also have bandanas, a very nice bandana to give to people that you know, that need it. So let me know, and I'll be able to provide those to everybody, okay?
Okay, Maria.
Liaison,
Yes.
just two very quick things. One is dovetailing on Tanya's suggestion. I would like to just make sure that we have someone from DEP, the Department of Environmental Protection. They are the people who are responsible for, they're the ones that carry noise permits. I mean, noise meters. So I want to make sure they're there. And not related to that, next week's meeting, I just want to let everybody know that with the last couple $100 that the community board had in in the last fiscal year, we were able to procure several trash grabbers and a bunch of bags. So if anybody wants to join me, I go out a couple nights a week, pick up garbage in parks. You know where to reach me. It's a rockin' good time. Who doesn't like garbage? So
Yeah, I got your text on DEP. Yeah. So for my third time, I'd like to call this meeting to order. Can I get a second?
Adjournment. It's already in order.
Alrighty, thank you. Have a great night, y'all.
Okay.